Good evening po sa inyong lahat. This is Dr. Mike and welcome to my YouTube channel. Today is Sunday, September 6. Kumusta po kayo mga kababayan? Sa lahat po ng ating mga viewers and mga subscribers po, happy Sunday po sa inyong lahat. Maraming salamat po sa lahat po ng mga friends natin na laging sumusubaybay sa ating live stream. Tinitignan ko po kung nasa nasa live chat na tayo. So ayan, nasa live chat na po tayo. Kumusta po ang inyong araw? Naging busy po ang araw natin ngayon because we were able to meet some of my friends and abangan nyo, we were able to shoot uh, a video yung pong para sa vlog natin. Abangan nyo yun. It would be a good episode para po sa inyo. And I am excited because tonight, ang topic po natin is medyo common at saka medyo napapanahon po ang topic natin tonight because ang topic natin ay ang title ng topic natin tonight is when seasonal flu meets COVID-19. Yun po yung topic natin ngayon ngayong gabi. And I invited a good friend of mine to be our guest. But before anything else, let me greet our viewers watching tonight. Oh, ayan po. Si Miss Jocelyn, thank you Miss Jo. Chris, good evening. Jake, hello Jake. Kumusta Jake? Hani, Sharon, Lenny, Ann. Maraming salamat po. At yung pong mga iba pong mga friends natin sa Malaysia, si Sweet Honey, si Lourdes, si Miss Delia at mga Noranians, maraming salamat po. Yung pong mga taga-Japan sa US, UK at sa iba't iba pong lugar. Pasensya po kung hindi ko po kayo ma-mention lahat. But later on, at the end of our program, I'll try po balikan at i-mention po kayo. But anyway, ang question ko po sa inyo is, natatakot po ba kayo? Sa bagay, sino nga naman bang hindi natatakot when parating na po ang malamig na ang simoy ng hangin sa ibang parts ng lugar natin. Yung Burr months na tinatawag. And because nagsimula na ang September, di ba? And nagsisimula na po, nagbabago po yung panahon natin. And ano kaya ang mangyayari? Because there's an existing pandemic, COVID-19, and may paparating na seasonal flu. So, are you protected? Yun ang question ko sa inyo. Or, alam po ba natin ang gagawin natin? Yun po yung mga tanong. Okay? So, isipin po natin, ano kaya ang possible na mangyayari when a virus and another virus mag-merge? Or, ano kaya ang mangyayari sa kanilang dalawa? Kung pwede ba na ang isang tao ay magkaroon ng seasonal flu, for example, and COVID-19. So yun po yung mga tanong natin ngayong gabi. And I invited, sabi ko nga, a good friend of mine, let me introduce muna. Ayan, dami yung mga friends natin na si Miss Vilma, si Jake, si Karen, si Normie. Maraming salamat po. Introduce ko muna ang ating guest para po sa inyong lahat ng mga viewers natin. Our guest for tonight is an emergency physician by training. He has worked in the University of Hong Kong and the emergency departments in Hong Kong, Sydney, and Edinburgh. He has a special interest in integrating infectious disease prevention and public health. So walang iba po, a good friend of mine. Please welcome Dr. El Pilio.
Hi, hello everyone. Can you hear me clearly?
Yes.
Yes, so very nice to meet you all online. Yes, okay.
Supposed to be a meeting, Dr. Leong, face to face, but because of this situation, we decided that we do it by Zoom. Okay, how are you, Dr. LP?
Fine, very nice. Okay, so how are you, Michael?
I'm good. How are you coping today with this current situation, with this pandemic?
Basically, we must follow the instructions by the government. Okay, so stay at home mostly. Okay, don't eat outside. Okay, and keep social distancing and take care of your hand hygiene.
Okay.
Yeah.
Thank you so much, Dr. LP. For the benefit of our viewers watching us tonight, because there are plenty watching us tonight on our live stream chat, can you give us a background about seasonal flu?
All right. Now, I would try to avoid to be too technical or too academic. All right, but we try to explain seasonal flu in layman's term.
Yes.
Okay, but as all of you should know, seasonal flu is caused by the influenza virus. right? And influenza, there are three types of influenza virus: influenza A, B, and C. Now, basically, what is causing most problems in human is influenza A. This is the major culprit. And
Mm-hmm.
then, to a lesser extent, influenza B. But influenza C does not affect human. So there's no need to pay attention to influenza C. And most of the attention should be given to influenza A. All right. Now, talking about, say, the frequency or the incidence,
Incidence.
okay, it is difficult to tell you an exact number because in many countries, influenza is not a reportable disease.
Okay.
But you can imagine around the world, there should be billions of cases.
Mm-hmm.
And I can give you some statistics by the WHO. So around the world, there would be 3 million to 5 million cases of severe illness caused by influenza. Now,
Oh,
by severe illnesses, I mean those patients may require critical care or intensive care.
uh-uh.
And for the number of deaths, it amounts to 250,000 to 500,000 per year.
A lot. It's a lot.
Yes, so you can imagine the magnitude of the influenza illnesses.
Mm. And for the benefit of our viewers watching tonight, uh, which month of the year that this seasonal flu usually spike or increase in numbers?
Now, it depends on where you are.
Okay.
Okay, for example, in tropical areas
Mm-mm.
like in the Philippines,
Philippines.
influenza occurred throughout the year.
Okay.
However, in regions on the north side, that is the northern hemisphere,
Mm-hmm.
usually seasonal flu would start in early autumn, peaks in mid-February, and ends in late spring of the following year.
Mm-hmm.
So you can expect that in Hong Kong, which is in the northern hemisphere.
Mm-hmm.
So just in 2 to 3 months' time, you will experience the first surge of influenza illnesses.
Oo, ayan po mga kababayan na. So nabanggit po ni Dr. LP na in 2 to 3 months, particularly dito po sa Hong Kong. So sometime in November, October,
Yes,
and towards the end of October, November, December, January, February, probably until March of next year. But in the Philippines, it's year-round.
yes, you
Yeah,
can find, yes, people infected with influenza in the Philippines
in the
all around
Philippines.
the year. Yeah.
Oh. And then you mentioned a while ago that influenza, among the three types of influenza, A is the most common.
Yes.
Okay. And my next question would be, since you've mentioned the incidents, the occurrence, and about influenza, how can we protect? Because our viewers, after hearing this, they might be scared. They want to protect themselves.
Yes, there are actually many things that you can do to
Mm-mm.
prevent contracting the influenza illness. Obviously, the most important thing is to take care of your good self.
Mm-mm.
Okay, do regular exercise, have adequate sleep,
Mm-mm.
and stay in good ventilated areas. All right, so all these are the basic things. And another area that one should pay special attention is obviously hand hygiene that we repeatedly mention. You may have heard of this term on television or from radio or whatever. Hand hygiene basically means that you have to wash your hands frequently, and you should avoid touching your eyes, nose, and mouth with your hands. All right, so this is very, very important. And the
Mm-mm.
third way that you can consider, or actually you should do, is to take a flu shot or to receive a influenza vaccine.
Okay. Since you mentioned about the vaccine, what is the indication for this vaccine? Because, for example, I was injected last year of seasonal flu vaccine. Should I get it again this year?
Yes, now basically influenza vaccine is indicated for anyone
Okay.
aged 6 months or above. All
Okay.
right, that is from babies to the
Mm.
very old. They
Okay.
are eligible to receive influenza vaccine.
Mm.
And it is especially indicated for people with an underlying medical problems. For example, you got kidney failure. All
Mm.
right, so you should receive influenza vaccine.
Mm.
And in responding to Mike, your last question, that is, I got it last year. Should I get it again this year? The answer is yes. The main reason is because for influenza A, I wonder whether, say, you have heard of the term antigenic drift. All right. So this, put it simply, means that on the surface of the virus, there are changes on the protein molecule.
Okay.
And because of these changes, the strain that occur or prevail in last year may be different from that in this year. In
Okay.
other words, talking about the influenza vaccine in particular, you
Mhm.
should get the vaccine yearly. All
Year.
right? Yes, because the preparation of the vaccine for a particular year will be different.
Okay. And then how many shots? If I would get it this year, how many shots? Is it one time only? Or what is the dose also? Because some of our viewers might be interested.
Yes, one dose would be adequate.
Mhm.
Okay, one
And,
dose.
and is it injected which part of the body? Um,
Now, yeah. Now it is injected we call it intramuscularly, that is into the muscle. And so commonly it will be injected at around the shoulder.
mm-mm,
Okay, so at the deltoid region.
mm-mm,
Okay, although in some, they may inject at the buttock. But I
mm-mm.
think for children, for adults, for the very old, the shoulder region should be fine enough, should be good enough. Yeah.
I think, I need just to repeat with our viewers, okay? Kailangan po pala natin na kailangan magpabakuna tayo for seasonal flu every year. Kasi po, maaring yung pong, yung last year, iba ngayon this year. So, kailangan po nating tandaan yon. At ang ini-inject po siya intramuscular, sa muscle po siya ini-inject. And how about the possible side effects of this? Because some people are afraid because of it's a vaccine and it's a virus
Hmm.
that you are injecting to that person. So, what would be the possible adverse event or side effects about this vaccine?
Now, in general, side effects are few and rare. All
Mm-hmm.
right, and but in specifically for side effects, the most common ones would include, you may have soreness or redness or mild swelling at the site of injection, and usually these should disappear in 1 to 2 days time. So these are the most common ones, and I don't think they would cause any significant problems to you.
Uh-uh.
Although in theory there are other more serious one. It's some kind, there is a specific name called the Guillain-Barré syndrome. Okay, basically this is a very serious reaction, but I must emphasize this is very, very, very rare. And in the medical literature, it is quoted that there might be 1 to 2 cases per million doses of vaccine given. All
Oh.
right, 1 to 2 cases per million doses. Now, talking about this, influenza illness itself may also cause this syndrome,
Mm-mm.
and the incident, as quoted in the literature, is 17 per million infections.
Mm-mm.
So you can immediately get the idea. Guillain-Barré syndrome side effect 1 to 2 cases per million. But the same syndrome in patients affected by influenza,
Mm-mm.
17 cases per million. So it is even rarer than the
Very.
disease itself.
So I
Yeah.
think it's very safe. This vaccine
Yes.
is very safe, and it can be injected from babies from 6 months until 65 or so, right?
Yeah, until the very
Oh,
old, and even in the pregnant.
oh,
Yeah.
yes. Okay. If it's pregnant, how about a pregnant patient? Can they have it as well?
Yes, they can.
They,
Yes, they can.
regardless of which trimester that they are
Yeah,
into.
they can get it.
Okay.
Yes.
The other concern for this vaccine, just like with the other vaccine, is the component of this vaccine because some of our friends with different religious backgrounds or beliefs, they cannot receive porcine or pork related vaccine in terms of the ingredients. Is this safe? The flu vaccine, is it safe for our friends from other religious beliefs?
Yes, it is safe. It is safe. And yeah, actually, before this session, I've contacted the pharmaceutical companies about this, whether, say, the vaccine can be injected in a Muslim, for example. Okay, and yes, okay, there shouldn't be any problem with regard to your religious belief.
Mm-mm.
Yeah.
Okay. How about if I am sick? If I'm sick today, for example, can I receive the vaccine, the flu vaccine, flu shots today?
Now, preferably you should avoid it,
Mm-mm.
taking it today.
Okay.
In case you have an illness or sickness like fever today.
Mm-mm.
And but however, when you fully recover,
Mm-mm.
okay, you can get the vaccine. Yeah.
Okay. How about receiving, if I am scheduled, for example, today to receive MMR vaccination, is it okay that I would receive, since I will go to the clinic, for example, I would receive MMR, can I receive flu shots at the same time?
Now, again, my advice is you should separate the two injections.
Mhm.
Now, just imagine your body may be confused by two vaccines at the same time. Okay, so preferably or by common sense, it may be better to have the flu vaccine, say, a week later.
A week later. At least
Yeah,
1 week po ang spacing
yeah.
of the vaccine. Okay. How about any contraindication for this one? Can we say that, oh, this patient, you cannot receive flu vaccine?
Now, basically, the most obvious contraindication is you are
Okay. Mm-mm.
allergic to the vaccine. For
Mm-mm.
example, if you got a reaction to the vaccine last year, all
Mm-mm.
right, you should avoid or you should be very cautious if you are thinking of receiving one this year. And
Mm-mm.
another commonly mentioned contra or relative contraindication is in case you got allergy to egg, all
Egg.
right, you should be careful. But it is not, but it doesn't mean that you cannot
Mm-mm.
receive the vaccine, even if you are allergic to egg, all
Mm-mm.
right? However, you should be cautious.
Mm-mm.
And in case your reaction to egg is very severe, it
Mm-mm.
is recommended that when you got the flu vaccine, you should have it injected in a hospital, all
Okay.
right, just to prepare for the occurrence of a severe reaction, all
Uh,
right?
how about for those patient or viewers who are watching tonight that they received the flu shots already last year? For how many months or years that they will be protected in terms of receiving this shot?
Now, as we discussed this in the beginning, because the strain of the influenza virus varies each year,
Mm-mm.
so you can get the idea immediately that the vaccine you received last year, at most, would only be effective till the end of this year. All right, because you don't know whether the strain this year would be the same as last year.
Mm. Oo. So ayan po mga kababayan na, so hindi po enough na na-inject po tayo last year, tapos this year hindi tayo magpapa-inject to another because nag-iiba-iba po yung strain. And with that, how about we've mentioned about the seasonal flu, and I think some of our viewers may have some questions later, but the concern is currently we have this existing pandemic, which is COVID-19. Any update first about the COVID-19, the vaccine in particular?
Yes, now, as you may have heard from the news, so far there is no COVID-19 vaccine in the market.
Okay.
All right. But according to the latest data,
Mm-mm.
around the world, there are 33
Third.
COVID-19 vaccines undergoing clinical trial.
Mm-mm.
And out of these 33,
Mm-mm.
six are
Okay.
already in the so-called phase 2 clinical trial.
Okay.
Phase 3 clinical trial. Okay. By that, we mean the vaccine, the experimental one, okay, uh, is now given to very large number of people
Mm-mm.
to test its, say, safety, efficacy, side effects, etc.
Mm-mm.
Okay.
Mm-mm.
So in the near future, you may anticipate three may come out first.
Okay. Yes. So ayan po ha mga kababayan, meron pong 33 vaccines na kinokonduct. sa ano, tapos may 6 po na nasa phase 3 na sa kasalukuyan. So abangan lang po natin kung kailan po ilalabas itong mga bakuna para sa COVID-19 na ito. And since we have this pandemic, as I have mentioned, and the seasonal flu is coming, what would be the possibility of merging or having problems coexisting of these two?
Yes, this is a very good question because although this hasn't happened yet, okay,
No.
but I suppose you should agree with me that there is a very high likelihood this will occur. As you know, right up till now, we don't have an effective vaccine for COVID-19, so you would expect that the COVID-19 may linger on for no one knows, okay, for years, all right, for decades, no one knows. And for the seasonal flu, it's bound to come back by the end of this year. So it is very, very likely these two would merge or would meet each other. As for the question, what may happen? Again, no one can know for sure because this hasn't happened. But but I think that you can feel this from two perspectives. One perspective is from the community level, okay, from the community level. Now, basically, the measures to prevent these two are the same.
Okay.
So in other words, what we are doing right now for the COVID-19 may, to a certain extent, prevent influenza by the end of this year. So, in other words, the incidence of influenza may be reduced because of what we are doing right now for COVID-19. Now, this may be a good thing, but no one knows. Now, another perspective is on a personal level. Now, because these two viruses mainly attack your respiratory tract, that is from your throat down to your lung, all right? So it means that the symptoms they produce are very, very similar. You may have fever, you may have cough, sore throat, running nose, etc. Okay, very similar. And so you can imagine the consequence is it would be extremely difficult to differentiate the two. You cannot be very sure in the beginning which is influenza, which is COVID-19. And this may cause problems, obviously.
So ayan po mga kababayan since because nga ito, this would be the first time na itong dalawa na mag-exist together, we don't know what will happen. The question might be thinking would be how can we prevent that how can we prevent ourselves from having either of the two, because most of us would be afraid if these two would coexist and or would merge inside our body. But how can we protect this one, because since it's a virus, it's very small, and the transmission, how can we protect ourselves?
Now, basically, the thing that we can do to protect ourselves are those simple but effective things that we have repeatedly mentioned. But I myself would think hand hygiene is extremely important. Hand hygiene, all right? Always take good care of your hands. This is extremely important. So I suppose everyone right now should have the habit of carrying a small bottle of the alcoholic gel, hand gel sanitizer, those kind of things, okay, to clean your hands, say before you eat anything. So this is a good habit, and this is simple but effective.
Mm. Oo. And then probably let's ask our viewers. Let's see the questions from our viewers. Yung po mga kababayan natin may gustong tanong po, please lang tanong niyo po, lagay niyo lang po sa ating chat box, and we will try to answer with our guest, with Dr. Leong. Okay? For example, this question, SARS from Miss Bukat, SARS, H1N1, and now coronavirus 2019, coronavirus 19, COVID-19. What are the differences?
Now, basically, they belong to different classes of viruses. Okay, for SARS, it is also a type of coronavirus, but of a different families. All right, but for H1N1, it is the influenza virus. It is different from the coronavirus. influenza virus. Now, academically speaking, it is a myxovirus, myxo, M-Y-X-O, myxovirus, okay? For the COVID-19, again, it's similar to SARS, but it belongs to a different species.
Mm.
Yeah.
Okay. And another question from Miss Vilma, can we take vitamins like vitamin C to protect ourselves?
I don't think so,
Okay.
okay?
Okay.
In theory, it cannot protect yourself.
Okay.
Yeah.
Vitamin C cannot protect ourselves alone.
Yeah, so don't rely on vitamin C.
Don't rely on vitamin C.
Yeah,
Okay, because there's so many advertisement now that to boost your immune system, drink a lot of
right.
vitamins, etc. But
It can't. It can't.
not.
Yeah.
Based on medical literature, it's not. Okay. Another question. In terms of the vaccine, if I would be injected to this year, am I protected with influenza B at the same time? Is it trivalent or
No.
bivalent?
Now this is again a very good question.
Yeah.
Okay, so for the vaccine so far we have been discussing.
Mm-mm.
Okay, it's a quadrivalent type
Oh,
of vaccine. That
uh,
is, it covers four
force.
strains,
Okay.
including two strains of influenza A
Oh,
and two strains of influenza B.
mm.
All
Oh,
right. So to a certain extent, in response to this question,
mm,
influenza B, to a certain extent,
mm.
is protected.
Okay. So I repeat po ha, i-explain ko lang po. Yung pong bakuna na meron ngayon, bali apat po. Dalawa pong influenza A na virus na meron doon at saka dalawang influenza B ang meron doon. So protected ka doon sa apat, bali, na strains ng virus. Oo. 'Yon. Another question, Doc, is it expensive or is it free from the Hong Kong people? The vaccine. Can the domestic workers avail for a free? Because some residents, I don't know. Can you say something about this? Mm-mm.
Now, so for many years, the Hong Kong government has provided subsidies
Mm-mm.
to people who want to get a shot of the influenza vaccine, but there are certain criteria that one should fulfill.
Mm-mm.
And the primary one is you have to be a Hong Kong resident,
Hong Kong rest.
okay, holding a valid Hong Kong ID card.
Okay.
And for adults, okay, you should be aged 50 or above.
Mm-mm.
50 or above, then
Okay.
you can get a free shot,
Mm-mm.
say from private doctors.
Mm-mm.
But just in order, but I can give you an example of mine. So we are right now, okay, we are planning to provide the influenza vaccine just at cost,
Okay.
and the cost is around $250.
Okay. Yeah, because some of our viewers are asking, what if just like this one, for seasonal vaccine, where can we get it if I want the shot and the cost? That's the first question. And then the second question is, what if there's no pandemic? Or what I'm saying is whether pandemic or not, is it really a need to have a flu shots every year?
Um, yes, even if there's no pandemic, you should still get a shot of the influenza virus, influenza vaccine. So this is because of its probability of causing serious illness, including death. All
Mm,
right. Now, this is especially the case if you are, say, getting old or you have any underlying medical illnesses. For example, if you are diabetic,
mm,
then obviously you should get a shot to protect yourself because it is well known that
mm,
people with underlying medical illnesses, for example, diabetes, is particularly vulnerable to
mm.
the complications of influenza.
Mm, okay. Yes. Okay, and meron pa ba tayong question sa mga viewers natin? Uh, another one, stress. Because some of our domestic workers are so stressed with their work, etc. Can stress lead to uh, problems like influenza?
Now, stress itself would not lead to influenza, but it may make you more vulnerable.
More vulnerable.
More vulnerable because again, the same principle of the immune system. So, you know, whenever people are under stress, okay, it weakens your
Uh,
immune system. All right.
uh,
This is why you are vulnerable.
Another concern, Dr. LP, are there any side effects for the long-term use of alcohol and hand sanitizer?
No, I don't think so. I
Uh,
don't think so. As long as you use it properly, okay, you just apply to your hands instead of drinking it. All
uh,
right. So I don't think it would have any long-term
uh,
effects. Yeah.
And another one, any basic medications to keep in mind if you feel some signs or symptoms of flu that can be bought from the counter without seeing a doctor?
Now it depends on what you want. Okay. Say if you just want to have, say, symptomatic control, say you got fever, you
Mm-mm,
want to manage the fever, then obviously you can buy Panadol over the counter. All
mm-mm,
right. But for those more specific medication for treating the virus, say, I wonder whether you have heard of the Tamiflu. Okay, Tamiflu. This is a drug specifically for treating the virus. I don't think you can buy it over the counter.
mm-mm.
And I don't encourage you
Yeah.
to take it by yourself.
Yes, because
Yeah.
I think for those yung pong nagtanong sa atin nung question na yon, I think kailangan niyo po munang tignan or pumunta sa doktor para po malaman kung ano pong mismong sakit ninyo because mahirap po mag-self-medicate. If you are self-medicating sometimes, yung pong gamot hindi akma doon sa sakit na ininom, baka lalo pong mag-worsen yung sakit po ninyo. Uh, and any tips, Dr. Leong, for our viewers watching tonight, particularly with this uh, seasonal flu that what would be coming, and also this the pandemic, there and then the possibility of meeting together.
Yes, Michael, maybe before I answer your question,
Mm-mm, mm-mm.
I need to remind the viewers a point that I have missed earlier.
Okay.
When we talk about the influenza vaccine,
Mm-mm,
in the market, there are two types of influenza vaccine.
mm-mm,
So all along, we have been discussing the quadrivalent
mm-mm,
uh, vaccine, which is in full, it is called quadrivalent
mm-mm.
inactivated influenza vaccine. And in the market, there is a second type. Okay, it is called a live attenuated influenza vaccine. Now,
Okay.
there are some differences that I want to emphasize here. Now, for
Mm-mm,
the inactivated influenza vaccine, it
mm-mm,
is made of dead viruses. Dead viruses.
mm-mm,
For the live attenuated influenza vaccine, it is made of weakened viruses.
mm-mm,
They are not dead, okay, just weakened.
mm-mm,
Now, the important difference
mm-mm,
are two, all right? Now, for the inactivated one that we have been discussing,
mm-mm,
all right, is given by an injection.
mm-mm.
But for the live attenuated one, it is by giving a spray at your nose, all
Oh.
right, a spray at your nose, not by injection.
Mm-mm,
And another important reminder here is for the attenuated one, okay, the live attenuated one, that is the one with weakened viruses.
mm-mm,
It is contraindicated if you are pregnant.
mm-mm,
It is contraindicated if your immune system is weak. All
mm-mm,
right. So the reason is obvious because the viruses that make up of this vaccine is not dead.
mm-mm,
It is just weakened.
mm-mm,
Okay, so I want to emphasize this point
mm-mm.
before I answer your question,
Yeah.
Michael.
By
All
the
right.
yes.
Yeah.
Before we move forward, the question of most viewers, particularly now, is because of the demand of this flu shots. Either the one you mentioned is, will there be enough of supply in the market? Particularly now that most people would be curious or would want to have this vaccine.
Yes, I suppose we would expect there would be a very great demand
Okay.
for the influenza vaccines
Okay.
around the world. Okay, the demand is from around the world. And in Hong Kong, from the experience of previous years, usually the supply should be adequate, okay, to cover all the demand. But you know, it is economics, all right? So when the demand is very big, when even if it is bigger than the supply, you know, the market price of the vaccine would go up. So if you want to get a shot of the influenza vaccine, get it early.
Very early.
Yeah.
Is there a specific timing that I should get? Can I get it, for example, if the vaccine is available this month? Can I get it this month already?
I suppose you preferably you may get it say in October.
In October.
From October onwards, then you
Okay.
should
And I would
think
be
of getting one.
protected from October until next year. Am I right? Will I be protected? Sorry? Uh,
Sorry, Michael, I can't hear clearly.
okay.
I can't hear clearly.
If I would be injected for the flu shots this October, I would be protected until next year for the next season of the virus, if in case.
Yes, now, but again,
Mm,
theory, all right? Theory, the efficacy is around 70% to 90%.
yes.
Okay, it means that there may still be 10% to 30% chance that you may get influenza illness even after a vaccine. But anyway, the chance of being protected is much higher.
Mm.
Yes.
There's one more question here with Mr. Jake. He's a SARS survivor, and is it possible to get a flu shots again? So she survived SARS, and now she's curious if she would be if she can get a flu shot.
Oh, certainly yes.
Okay.
Certainly yes, because you know, SARS virus is different from the influenza virus.
Mm-mm.
Yes.
Yeah.
Yeah.
Mm-mm. Okay, so if you have other questions po, feel free to chat. Anyway, any tips to our viewers, Dr. Young?
Yes, I suppose the tips include two aspects. All
Mm-mm.
right. Again, good hand hygiene. All right. All the measures that you are doing right now are still apply. All right. Still apply. And the second thing is do get a flu vaccine.
Mm-mm. Mm.
Yes.
There's another question that I
Right.
saw. Hi, Dr. Young. Good evening. Do you recommend Hong Kong citizens to join the community testing or the domestic workers to join the community testing program? Do you think it's effective? It's an effective way to test COVID-19?
I think so. I think so. So I think everyone living in Hong Kong should support this universal testing for COVID-19. It helps not just other people, but yourself.
Mm.
Yes.
Okay. And yes, and any other things that you would wanna say if they would want to avail? Can we give, as if I can give you the discount or any things that we can offer our OFWs or our kababayans in Hong Kong? Because how much is the original price of the vaccine? Because some of them, if it's too expensive, they cannot afford. Sometimes their employers are the one paying for the vaccine, or sometimes they pay from their own pocket. If we have a specific discounts for domestic workers, since the government may not be able to provide a free vaccine for them. Yeah.
So I think the current price varies. Okay, I haven't done a market research, so I can't give you a definite answer. But as far as I'm aware, or from my own perspective, we
Mhm.
can provide the flu vaccine at cost.
Mhm.
Okay, at cost that is around 250.
Okay, I think
Yeah,
250 is manageable.
yeah,
Uh,
and reasonable. Yeah.
so you need to save 100 and another 100 for next month, or 150 um, for
Yes.
this one. And where can they avail this vaccine? For example, I want to have a shot. Can they go to public hospitals, private clinics? So where they can go?
Yeah, I suppose if you do not fulfill the criteria
Uh-uh.
of receiving the government subsidies,
Mm-mm.
you may get it from any private clinics or private doctors.
Mm-mm.
Yes.
Okay. So with that, thank you very much,
Thank you, Michael.
Dr. Young, for spending your time with us tonight. to our kababayan.
You are
And
welcome.
do you want to greet anyone or do you want to say something before we allow you to? Yes.
Okay, just hello everyone. I hope our discussion tonight would benefit you and would remind you how to protect yourself from COVID-19 and influenza towards the end of this year and stay healthy. Yeah. Okay.
Thank you so much, Dr.
Thank
Young.
you, Michael.
Hope to see
Yeah.
you soon again. So I hope we can invite you again in the near future to get
Certainly.
our program.
Yeah,
Okay.
certainly.
Thank
Okay.
you. Thank you.
Thank
Thank
you,
you.
Michael.
Thank
Thank
you.
you. Yeah.
Okay, so ayan po ang ating guest for tonight na si Dr. Leong na nagbigay po ng kanyang an answer para po sa mga kababayan natin gustong maunawaan yung topic natin ngayong gabi, when seasonal flu meets COVID-19. So nabigay po niya lahat kung ano po ang seasonal flu, ano po yung mga latest updates of COVID-19, even the vaccine. Again, the bottom line is to make ourselves healthy. Hand hygiene, napaka-importante po. But I think by this time nga, sabi ni Dr. Leong, alam na natin kung paano natin ingatan ang ating sarili. Not just about wearing the mask, but also proper hand hygiene. So, maraming salamat po. Ito po yung maraming salamat sa mga super chatters natin na nandoon, na nanonood ngayon. Si El, si Moshi, maraming salamat po. At yung po mga friends natin patuloy po nanonood, si Jocelyn, si Chris, si Jake, si Sharon, si Lenny, si Annie, si Ann, Cares, Vilma, maraming salamat Vilma, Gigi, Miss Anna Marie, maraming salamat. Si Chris Joffrey, hi Joff, maraming salamat. Si Annalisa, maraming salamat. Miss Evelyn, maraming salamat po sa inyo talaga. Oo, yearly, sabi nga ni Dr. Leong, Cares, yearly ang i-inject natin, pagbibigay ng flu shot sa mga pasyente natin. Si Ms. Ramos, maraming salamat po. LBU, okay, El Bueno, maraming salamat din. And sa lahat po nanonood sa atin, maraming salamat. Don't forget po to like, share, and subscribe sa channel natin. And abangan nyo po yung raffle natin sa susunod. Malapit na before the end of this month, magpaparaffle tayo. Mamimigay natin lahat yung mga sinabi ko last time sa inyo. Hanggang sa muli po, sa patuloy nyo pong pagsuporta sa atin, sa lahat po ng friends natin, mga new friends natin, yung subscribers, at also the Philippine Consulate General, maraming salamat po. Abangan nyo po yung topic natin this coming Wednesday. It's all about chronic renal failure. So yung po mga kababayan natin na may problema sa kanilang kidneys, yung pong mga dialysis o yung mga may end-stage renal problem, abangan niyo po yung topic natin. Another doctor, nephrologist, expertise po niya yung mga kidney. So yun po yung episode natin this coming Wednesday. So hanggang sa muli po, this is Dr. Mike. Magandang gabi po at have a great week ahead of you. So have a great night everyone. Maraming salamat po.